Welcome. Thank you for joining today's info session on this groundbreaking partnership between UNIFOR and Cannabo Medical Clinics. My name is Mike Cercelli, Vice President of Clinic Operations at Cannabo Medical Clinics. This partnership has been in development for some time and is really focused on ensuring today's worker has the education and the ability to make an informed decision on various treatment options available to them and truly optimize their life. Depending on the status and date of your collective bargaining agreement, you may already have coverage for medical cannabis treatment options. One of the great things about this program is that Cannabo Medical truly believes in treatment accessibility, and UNIFOR has negotiated a special offer with Cannabo Medical for all members regardless of coverage. We have three fantastic medical cannabis pioneers joining us today. Dr. Michael Verbora, Chief Medical Officer at Aleafia Health, a highly regarded medical cannabis expert worldwide. Mary Somerville, Cannabo Medical's lead patient educator and RPN. She has several years experience working with and advising medical cannabis patients. And Gerald Major, with his inspiring story on his journey thriving with spondylitis. Without further ado, I'm going to pass it over to Michael Verbora.
Thank you, Mike, for that introduction, and thank you everybody for joining us today. I want to walk you through a little bit regarding medical cannabis. This is the agenda for today. I'd like to share with you a little bit about medical cannabis, the effects on the human body, what the science says around medical cannabis with respect to benefits or risks. What are some of the different formats that patients are using daily? And then we'll talk a little bit about the Cannabo Medical Clinic and what it's like to become a patient. And then we're blessed with Gerald Major's presence today to share his patient journey. Lastly, we'll wrap it up with some Q&A. So why is medical cannabis an important consideration for health and wellness? Well, if you look at the growth of use of medical cannabis, we see that this continues to rise. And so more and more patients are really looking for safer alternatives than traditional options. And what we see here from data from Health Canada is that the expectation is that medical cannabis use will continue to rise. Now, the beauty of medical cannabis and why I, as a practitioner, really got involved in this space is that I really take that oath to do no harm to heart. And when you look at the scientific evidence on the risks of cannabis, the risks are actually rather small. And you have to put that in the context of the other situations that most doctors see, such as chronic pain, chronic anxiety, or insomnia, which the traditional way of treating is with opiates, benzodiazepines, or sleeping pills, all of which carry the risk of overdose, death, and other comorbid issues. And so as a physician, I really felt that there had to be safer options. And this is what led me down the path of medical cannabis. Because cannabis doesn't work on certain parts of the brain, unlike those other medications just mentioned, you cannot overdose on cannabis. That's not to say that you can't have side effects, because most things can cause side effects in any dose. But the reality is that no one's ever died today from the use of cannabis. And that makes it substantially safer from that perspective compared to some of the more traditional options. Now, if you look at Health Canada, what they've published is this great report. It's quite long and lengthy for medical practitioners. And they highlight and illustrate that there are at least 5 categories that they see that medical cannabis has potential benefits in or has ongoing research in. And so the first and perhaps the most common use of medical cannabis is for mental health, particularly anxiety and insomnia. The second area they identify is oncology, so patients living with cancer, whether that's side effects from the cancer treatments themselves or the disease itself. Then you have a group what we call other, which include chronic pain, HIV symptoms, weight loss. And then the 2 last categories are the immune system, which is really fascinating because a lot of people don't realize that medical cannabis, it's probably its most potent action is reducing inflammation by targeting the immune system. And inflammation more and more is becoming the cause of all of our diseases. And last but not least, the other area that Health Canada recognizes that medical cannabis has therapeutic potential in is neurological diseases. And that's your dementia, Alzheimer's, epilepsy, Parkinson's, etc. Now, it's not to say that we have great scientific evidence for all these areas, but in the early days of this research, we do have emerging evidence that cannabis is likely to be a medicine for many of these conditions. What's really nice about the work that I'm blessed to be able to do every day is to really try and help patients reduce their reliance on pharmaceutical drugs. And the big one that comes to mind is opiates. Given the epidemic that we face, opiate deaths sadly have gone up dramatically, 30 to 40% in some areas in Canada since the pandemic. We have as much as 20 to 30 times people dying per day from opiate overdose compared to the virus. And the reality is that we really need to get these people on safer alternatives, but also help manage their pain. And cannabis has been shown in this research study here on the slide to reduce the use of opiates. And it's really interesting data as well in the states showing that states that have access to medical cannabis have about a 20 to 30% reduction in opiate overdose deaths. Another way that cannabis is potentially really helping is when we use it in combination with traditional options such as chemotherapy. So today there's no substitute really for chemotherapy for certain cancers, but these medications can be quite toxic and cause a whole host of side effects. In this study, what we saw was that patients who used cannabis in addition to their chemotherapy had a substantially higher adherence to their chemo, allowing them to potentially have better outcomes overall. So let's shift gears. Let's talk a little bit about cannabis and particularly the medical components that we see in the flower. So some of you may have heard of sativa and indica. They're different historical strains or genetics, but nowadays, because these strains are quite old, they've all been crossbred. And the truth is we don't really have unique genetics that correlate to these two different strains. They're all hybrid strains. However, some may have more sativa properties and some may have more indica properties. This is mostly for flower when people are using the flower in an inhalation device. What we see is that people who have a more dominant strain, such as sativa, using that strain, they'll have a little bit more energy and it's better for daytime use. And people using an indica strain is more relaxing, and that's definitely more useful for nighttime. Now, in all of these strains, irrespective of sativa and indica, there's a bunch of ingredients. These are phytocannabinoids, the main ingredients that you've probably heard about, such as THC and CBD, but there's actually close to 100 different ones, which is really fascinating. So research is taking place today on all of these different cannabinoids and their medicinal properties. In addition to those main ingredients, you have terpenes, and terpenes are really fascinating molecules. They're in almost everything we eat or really smell that has a nice scent. So things like limonene, which are found in lemons and oranges, pinene, which is found in pine cones, these have medicinal properties. For example, limonene is an antidepressant, pinene is a bronchodilator, meaning it opens your airways and helps you breathe better. So these ingredients are also found in different strains of cannabis with all of those different phytocannabinoids. And then you have the last ingredients, which are called flavonoids, and there's thousands of them. We don't fully understand how medicinal they are, but patients who have a high diet in flavonoids, mostly fruits and vegetables, have lower heart disease. So we talked about this middle category here, phytocannabinoids, the one that the plant makes, but a lot of people don't realize there are synthetic cannabinoids, which are synthetic. So there is a synthetic THC that you can get from the pharmacy. It's called nabilone. But the problem as an experienced clinician in this field that I see is that it makes people very groggy and very tired. So while it can produce some anti-pain, anti-nausea effects, for example, people tend to feel groggy on it. That's in comparison to the phytocannabinoids. And then what a lot of people don't know, including doctors, because I'll be honest, in med school, they never taught me about this, but there's actually a system in the body called the endocannabinoid system, and your body makes its own cannabis. And this is pretty fascinating because on the next slide, you'll see how involved this endocannabinoid system is and how it's very much likely that our body's endocannabinoid systems, when we are suffering from a disease or a disorder, is probably not functioning properly. So this is that endocannabinoid system. The green and the blue highlight all the different areas of the body where cannabis or your body's own cannabis endocannabinoids can go and bind to and then create a bunch of different effects. This is a really old system. It's found in all animals. It has really important regulatory functions, and it's probably involved in a lot of different diseases, but we still don't fully understand it. So where is this system? Well, it's in your brain, it's in your immune system, it's involved in your cardiovascular function. A big one is how your body produces inflammation. The endocannabinoid system is extremely important for that. Appetite, digestion, bone development, and then how our brain learns, our memory, mental health, pain, etc. So you can see from this slide that there's really not a system in the body that medical cannabis or your body's own cannabinoids doesn't touch. And when all this system is functioning properly, the whole point of this system is to keep the body in a relaxed, healing state. And I suspect with time we'll learn that many people have a very unbalanced endocannabinoid system due to stress. So where does the cannabis bind to? Well, it's either the brain or the immune system. And in the brain, it technically relaxes the brain, slows down the signaling in the brain, which could be good for epilepsy or for pain or for anxiety. And in the immune system, it's great for blocking the production of inflammation. So it stops your immune system from making inflammatory molecules. Now, the two major cannabinoids that I think most people know about are THC and CBD. And it's really, really important to highlight that a lot of people think THC is just recreational, but that's not true. THC is actually researched a little bit more than CBD for medicinal properties. But the key here is the dosage. If you take small to medium doses, usually with the help of an educator or a physician or a nurse, you're more likely to get medicinal value. People who tend to self-medicate or take the advice of others who have a lot of experience might overtake THC, and that's where it leads to some of the side effects, risks, and harms. Now, if you use cannabis, particularly THC, properly, you should get anti-pain, anti-nausea effects, anti-inflammatory. Usually it stimulates appetite, and it can be really good at night for sleep and relaxation. Now, CBD, on the other hand, has no recreational value. Nobody's trying to, abuse CBD in any capacity because it doesn't have the impairment capability. So while CBD does still have some psychoactive effects, it boosts our serotonin, for example, which is our mood molecule, so elevates our mood. It doesn't cause impairment, even at relatively high doses. And so what is it responsible for? Well, it's an antioxidant, which means it mops up the body from, our cellular debris or changeover. It's anti-inflammatory, so it blocks inflammation in the body. It's an antiemetic, so stopping nausea. We use it as an anticonvulsant. So I have about 2,000 children in my practice with very severe forms of epilepsy, and we use CBD to help. It's also a great anti-anxiety because even if you take too much, you won't have the reverse effect, which you can have in THC, which is worsening anxiety. And then we use it as well for certain types of pain disorders. Okay, so hopefully that clarifies CBD and THC. And a lot of the discussion, even though the plant is complex, a lot of the discussion today with my patients is still around dosing the right amount of CBD and the right amount of THC. Now, what is the science around it? So a lot of people may have heard there's no science or there's a little bit of science, and it can be really confusing because headlines don't necessarily mean good science. It's just news. Well, this is a really good study. It's what we call a systematic review, which looks at 79 different randomized trials, which is kind of the gold standard in medicine. This is what you want to compare it to placebo. And what we found is that cannabis is better than placebo for chronic nerve pain, cancer pain, and spasticity to MS. It's also slightly better than placebo for nausea, vomiting, and chemo, weight gain and HIV, sleep disorders, and Tourette's. And where we're still needing a little bit more evidence is probably with anxiety. And I'll show you later that there's a good study with CBD that shows it's good for anxiety. But this is where the biggest gap is today. The number one reason people use medical cannabis is actually for anxiety, but we still need more research to validate that. So we all know it works, but we'd like to see the science to know what doses work best. This is another study. It's a 400-page document. It looks at numerous studies made up of experts around the world who studied this, over 250 different research articles. So there's actually a lot of science on cannabis. It is actually by far the most studied plant in the world. What we see here is that there is conclusive evidence that, again, it helps with chronic pain, chemotherapy, nausea, and vomiting, and MS spasticity. And those are kind of the big three with the highest level of science. And then we have evidence that it also helps with insomnia, people with fibromyalgia, chronic pain, sleep apnea, and MS. And then there's more and more science evolving predominantly around the mental health symptoms such as PTSD, which we see a lot of soldiers or vets dealing with these issues, anxiety, insomnia. Okay, So shifting gears, I'm just going to kind of quickly go through these, but I just wanted to highlight that again, this is more research showing that cannabis works for chronic pain. And this study, which is nice about it, is that it looked at patients with fibromyalgia, rheumatoid arthritis, as well as nerve pain. This is another one for anxiety. So this is a study that focused on just CBD. And this is the complicatedness of studying a plant like cannabis. You can't just study one strain or one genetic. You have to isolate some of these compounds, or you have to study just one at a time. And what you need to do is measure the dosage. And so that's what's hard to get all this research out of, because it's so complex. But this study showed that CBD had minimal side effects and produced an anti-anxiety effect. And then here's another study in migraine headaches. I do see a lot of patients on migraine headaches, suffering from migraine headaches. And what we do is usually use high doses of CBD to try to prevent them, and small doses of THC as needed when they're really bad. Now, probably the most important thing to me as a clinician is, how can I help patients clean up their health? And by clean up their health, I mean, let's look at your medications and the illnesses that you're dealing with, and how can we try to make sure that the treatments that for those symptoms aren't worse than the disease itself. And unfortunately, that's been happening the past decade. I won't get into the reasons for it, but the reality is many patients are taking 5 or 6 prescription pills. Sometimes the elderly, I think the average is 8 for somebody over the age of 65 in Canada. And what we see is people are on opiates and narcotics, they're on benzodiazepines, and these are actually very risky. So they have a risk of overdose and death. If you combine them with alcohol, that also causes more issues. They also affect your memory. They both lead to long-term causes of depression. And so patients will come see me after a year or two of being on opiates and wondering why, ever since starting opiate, they have 5 new health issues. And it's usually because the opiates have been used for too long. And so what my goal is as a clinician is to try to look at all these medications and say, how can we try to stop these and substitute for something safer like medical cannabis, where you won't get the health side effects? Okay. And this is a study that showed that people who use cannabis or have access to medical cannabis have a reduction in opiates and benzodiazepines, as well as all these other prescription medications. There's also scientific evidence for sleep. I appreciate that sleep is probably a big one. It's most often caused by anxiety. But again, cannabis has some good science there to support that it can be effective for sleep. I'm going to once again shift gears, and we're going to talk a little bit about some of the products that are available and kind of give you an oversight on how we use these. So when I see patients, we talk about all these different products, and what we try to do is match what's happening in the body or from a disease perspective with the right medicine formulation. And what that means is if you have chronic symptoms day, afternoon, and evening, it's better to be on something that lasts 6 to 8 hours. So you take it 2 to 3 times a day typically, so that you get that relief. And that's your oils, your capsules, or what some people are most familiar with are the edibles. And then there's also what we call medium acting formulations. So these kind of work a little bit faster than oils, and they don't last as long. And these are special slips we call kin slips. They go under your tongue and they dissolve quickly and go straight into your bloodstream. And then there's fast acting. So that's going to be for someone who has, like, let's say a panic attack or breakthrough anxiety, or can't shut their brain down at night for sleep. This is to work fast, but you want it to last only, an hour or 2 maximum. And this is through vaporization devices, which is a safe way of inhaling. It's not through smoking, which causes side effects of the lungs. And then there's other categories such as topicals, and that's good for more localized pain. So if you had a wrist issue or a joint issue or a muscle tissue issue, you would put a cream on that area and hopefully that would relieve it. And then you have other products like bath bombs as well for more of like a wellness relaxation product. So here are the cannabis oils, and what you'll see on all these slides is that they come in 3 typical products. They come in high CBD doses, they come in high THC doses, and they come in a balanced product. And the key here is to work with the Cannabo medical team to develop a treatment plan that's best for you, that minimizes the side effects but maximizes the benefits. These are the capsules, and again, you'll see that it kind of comes in the same formulations. This is the flower again. So the flower is no different than the oils. It also comes in high CBD, high THC, and as well as a balanced strain which has a mixture of both. And then these are vape pens, which is just flower extracted into a vaporizer device, which allows for very convenient dosing as needed. And last but not least, these are the kin slips. These are the little strips that dissolve under your tongue, and they work relatively fast. And I think these are most people's favorites. A lot of people ask about edibles. So edibles are really just cannabis oil in the format of a food product. I don't know that there's any science that they work better or not as effective, but they should theoretically be exactly the same as an oil or a capsule or spray. But some people like to dress up their medicine. Okay. And then, of course, the creams and the bath bombs. Okay, so I'm going to pass it over now to Mary.
Thank you, Dr. Vibora. Hello, everyone. Thank you for joining us today. I'm going to talk to you a little bit about our Cannabo medical clinics and how you can register as a patient through our Cannabo UNIFOR program. So at Cannabo Medical Clinic is a licensed clinic that has helped over 120,000 patients on their medical cannabis journey. We have continued to stay committed in providing the best care and support to our patients over the past 7 years. Cannabo has locations all across Canada from coast to coast, and you can be seen by one of our expert doctors, nurse practitioners, nurses, and trained educators in an easy and convenient virtual setting. As a patient through Cannabo, you will be given an individualized treatment plan based on your personal health goals and ongoing support from guidance of our dedicated team of healthcare professionals. Cannabo and UNIFOR have an exclusive, unique partnership, and we have curated a special UNIFOR patient journey to make the registration process easy and seamless. We have a dedicated team to service all UNIFOR members. Some of you may have coverage already, some of you may be in the early stages of getting coverage, and some may not have coverage. Regardless of your coverage status, as a UNIFOR member, you are entitled to this special UNIFOR Cannabo program, including special discounts and promotions. The simple process to register as a patient or to learn more about medical cannabis and to see if it's a right fit for you, you can go to our Cannabo website and select the UNIFOR icon. This will take you to a dedicated UNIFOR webpage. From there, you are going to be able to complete a confidential UNIFOR Cannabo self-referral form, and one of our Cannabo UNIFOR team members will reach out to book an appointment at your earliest convenience, including an option for same-day appointments. So you have the option to book an appointment the same day or at a time that suits best for you. If you are unable to go to our website, you can simply call our dedicated toll-free UNIFOR phone line, and one of our representatives will assist you in booking your appointment and can answer any questions you may have. You do not need a referral form from a family physician. You can just simply refer yourself through going to our website or calling the dedicated phone line. At the time of your appointment, which is done in a confidential and convenient virtual setting, you will be assessed by a licensed healthcare practitioner. From there, the licensed healthcare practitioner is going to assess your own personal goals and determine what is going to be the most appropriate products and formats that work best from you. From there, you will discuss with a patient educator, and our patient educator will go over your treatment plan with you, and they are going to also help you get registered with a Health Canada approved licensed producer, and also help you and assist in placing your very first order. Depending on where your location is, you all will also have the option to have that order, you will also have the option to have your medication be delivered same day. The entire process of booking your appointment, being assessed by one of our healthcare practitioners, completing education on your treatment plan can all be completed same day in under an hour. Our dedicated team will also provide ongoing support throughout your medical cannabis journey. This includes follow-ups on your treatment plans and being available for any questions, either through our dedicated phone line or our dedicated email. As a UNIFOR member, you will also receive an exclusive 40% off your initial purchase and 20% off all purchases going forward. This exclusive offer extends to all UNIFOR members, regardless if you have any coverage or you are entitled to this discount. We will be sending out all of our clinic contact information, including our email, links to our website, and our dedicated UNIFOR phone line through email to you all so that you can register as a patient at your earliest convenience or reach out with any questions that you may have. Next, I am honored to introduce you to Gerald Major. He's a patient advocate to share his personal story and experience with medical cannabis. Welcome, Gerald.
Thank you. This is an amazing day in patient care from my perspective, and I'm happy to share my story here. In hopes of maybe answering some questions to you. I mean, you're just going to hear my path, and it's unfortunate, but it's pretty topical for today. My journey started when I was about 14, 15. I started feeling aches and pains in my knees. So what later became juvenile arthritis. I was diagnosed at 18 years old, and coincidentally, that's when I started using cannabis. Medically or not, I mean, I obviously felt relief in symptoms. My pain level was through the roof. At 18 years old, you never think of experiencing pain like inflammatory arthritis, but many kids do. So I was one of them before there was really juvenile arthritis, and I started actually consuming cannabis medically in the year 2000, when there was kind of a system set up for medical users to basically grow your own. So that's kind of when I started using it, as I would call it, medically. That's the first time I ever filled out paperwork. And then so fast forward to about 2016, and I was seeing what you're seeing now, maybe for the first time, is an actual program around the medical patient, with doctors that were prescribing and providing education. So in 2016, I entered that program, which is really when I started using it medically. Now, back then there wasn't a ton of doctors willing to look at cannabis or willing to even prescribe it, for that matter. So you had to search for people. So what I did was I ended up becoming an advocate. I ran Citibank Hedge Fund Services North America. I was senior vice president at Citibank when I left the bank at 36 on long-term disability. Since then, I've had 16, 17 different surgeries, a lot of them major joint replacements. I log about 14 different comorbidities. So along with ankylosing spondylitis, psoriatic arthritis, I also have osteoarthritis, osteoporosis. That was probably caused by prednisone, being on prednisone very early. I have pain, chronic fatigue. I've got psoriasis, skin psoriasis, that's very well linked to the spondyloarthritis family. My eye gets swollen. It's called uveitis or iritis. And I mean, my most recent diagnosis, probably 4 or 5 years ago, was collagenous colitis. So you can imagine what it's been like being me over these years and actually trying to stay active and stay employed. So I went on long-term disability when I was about 36 or 38 years old, in and around that time frame. And it probably took about 2 years to get through massive depression. And so then I started really kind of looking at my journey. So a lot of the things that Dr. Verbora talks about in his slides are the things that I started doing personally. I knew inflammation was a big thing for me, and I found CBD. I take large amounts of CBD, and I use that for inflammation that's basically systemic. So it goes to my joints, it goes to my head, and basically calms basically everything down. What it then does is allows me to work out better. I burn about 1,200 calories a day through various activities. I stretch every morning for about 45 minutes. I can't live without it. And my diet's clean. So, I mean, the only changing factor in all these years has been the level of cannabis I've been using. When I first started using it, it was a lot of smoking and THC. But then when I started using it medically, I found CBD and the importance of that. Then I found out that because of my exercise level, I found that not only was it allowing me to warm up, and then I also take THC before training. So I get kind of loosened up. But then I get a whole ton of recovery benefit and a whole ton of endurance benefit that I wasn't expecting. I did this through kind of trials on myself over the years. So I found additional benefits of CBD, and that's probably likely due to the way that it calms the inflammation down. I smoke still. I wish I didn't. I vape. I mean, I have a big, I've done it twice now where I've tried to cut down my smoking. So I'll go to concentrates and oils as much as I can. I'm kind of doing that right now. But I use it for sleep, appetite, pain, anxiety. I've calmed down anxiety attacks with 300 milligrams of CBD quite regularly, actually. So I mean, there's tons of uses, and I can't wait for the research to start coming more and more on the other compounds. It's great for sleep, as is. I know that there's other compounds coming that are very interesting from a sleep perspective. And once you kind of address your inflammation and sleep, in my perspective, it has a trickle down effect into a lot of the other things that you could or may be experiencing. So I mean, I would consider yourselves to be in a great situation right now, having a couple groups come together and actually proactively come out to you and provide education and support. It's something that I didn't have back in 2016. So I'm happy to see that. I hope you take advantage of it. I hope you get curious at least. I know my first phone call would be actually to find out what my coverage was. So I wish you well in your journey. I'm around for questioning and everything. So I guess this is back to you guys.
Great, thanks, Gerald. Always love listening to Gerald talk. He's got a great story, so I appreciate it. We'll start the Q&A session. I'll lead it. We had several questions come in from the registration. If you haven't submitted a question through the registration process, that's okay. Please submit it through the chat box, and we'll be sure to get back to you personally. So our first question, some of this has been covered in the presentation, so which is great, but it's always great to go over it again. First question, I'm not sure if I have coverage. Is the 40% initial discount and 20% ongoing discount for members only with coverage? I can field this. So no, it's not. It's available for everyone. And like I said, Cannabo Medical is all about accessibility. And so these offers are for all members. So not only making, if you've got a treatment program, not, making your personal dollars stretch further, but even if you have coverage, making your coverage dollars stretch further. So that is available to every member, which is fantastic. Second question, how do I obtain a medical cannabis prescription / document? How long is the process? I'll send that back over to Mary if you want to take that question.
Thanks, Mike. Yep. So the process can actually be completed all in one day. Again, if you go to our Cannabo website and complete the self-referral form, or call us directly at our UNIFOR dedicated phone line, which is here up on the screen, we can get you booked in for an appointment same day or at your earliest convenience. And then you'll be assessed by one of our healthcare practitioners who will assess to see if medical cannabis is best suited for you. And if so, you'll be given a medical document. And then you'll be assessed you'll have a discussion with our patient educator who will get you registered with a Health Canada approved licensed producer same day, and also be able to assist in placing an order same day. And again, depending on where you are, you may even get your medication arriving at your house the same day. So it's a really quick, simple, and easy process.
Thank you, Mary. Okay, one more question that's come in here. I've heard much about the benefits of CBD. Will I feel high with CBD products? I'm going to pass this over to Mike Verbora.
Yeah, so it's a great question and obviously a concern. And so The answer is no. So CBD does not produce an impairment effect, and they've done a lot of research, for example, in driving. And so they gave people THC, they gave people CBD, and then they measured their overall impairment. And what we found is that there's no difference being under the influence of CBD versus being under the influence of nothing. So it's safe to use from that perspective.
Okay. Mary touched on same day, next day shipping options available. A question on that. I live in Atlantic Canada. Is same day, next day shipping available? I can answer that question. So generally, same day, next day shipping is available in major city centers. We haven't gotten to Atlantic Canada yet. That's something we're always working on. So we're hopeful we can offer that this coming year. But we'll let you know. Even if there's, the process on shipping is quite efficient, actually. So generally, product is ready for ship same day, next day, and then it's just delivery time. So your discrete package can get nationwide within just a few business days. So that should put you a bit at ease as well. We have a comment that just came in actually for Gerald, congratulating him on his story and his journey. So thanks again for sharing on that. And then that's pretty much it, all we have for today. As you can see, our phone numbers are available for you. Please contact us, whether it's by phone, by email, or on the web. We're available to help. If you do have any questions, don't hesitate to reach out to ourselves or your local union representative for more questions and getting those answers to you. So thank you again for joining, and I hope everyone has a great day.